And so building from that, we thought, let's think about what is it specifically in processes that we like. And so we started with these three pillars, and that kind of worked out organically throughout some of our conversations. And the first one that we thought that was kind of foundational as an attitudinal and interactional variable was the cultural humility pillar. And so this other orientedness, curiosity, and for me, like this came out of my thinking of it was about judgments. And so one of my first studies was about clinical judgments, and that as therapists, we end up making decisions pretty quickly, like within the first minute of meeting a client, and then we work to find more confirmatory evidence than disconfirmatory evidence, which kind of speaks to the opposite of what humility as a construct is really teaching us. And granted, I know, I mean, as I'm a practicing therapist right now as well, and sometimes you have to make quick judgments and you don't have a ton of time, but it's in those moments, it should be a moment of reflection in the session, or hopefully, especially after the session, of where did we go and what assumptions were happening in this session that led me down this path. And so I think from a check on ourselves, because I think as therapists, we want to be right, we want to be helpful, we want to do all these things that really the human judgment literature just does not support the processes that we do. And so this is a good counterbalance to that. I'll pitch it over to Karen.
Thanks. Yeah, I kind of harkening back to when we first started conceptualizing multicultural orientation, we really thought about it complementing multicultural competence in that MCO is a way of being that we can carry across contexts beyond the therapeutic context. We can also think about it in any interaction, which I think also really allows it to be sort of transferable. The skills that we use within therapy, we can also utilize outside of therapy in our interpersonal relationships. And so cultural humility, even when we meet someone in a non-therapeutic context, we can also recognize, oh, I'm coming up with some judgments. I mean, particularly now in our sociopolitical climate, how much that's happening and how much that gets in our way when we make judgments and we don't ask ourselves, where might that be coming from? Or hold on, I'm coming up with some, really fast and quick sort of assumptions about someone. So I just want to name the sort of transferable part of multicultural orientation. I'll talk about the second pillar and cultural comfort. And cultural comfort is really about what shows up in our bodies, what comes up somatically, physiologically, affectively, and sometimes in ways that we don't even have words for yet. That we notice something churning in our stomach, or we notice this sort of equanimity, calmness that we feel when talking about particular cultural topics. And, I'm not a neuroscientist in any way, shape, or form, but what I can say that I've gathered from neuropsychology and neuroscience is that we are really feeling thinkers before we're thinking feelers. And so we feel first. And so cultural comfort is a pillar in which we notice things that come into our sort of physiological somatic space that tell us that something's going on in an interaction with our clients.